My name is Bowen, CEO of Northwestern Medical Center and your host of the NMC Health Beat Show, dedicated to discussing hot healthcare topics. On today's show, I'll be talking to Nancy Fiske and Katy Magnuson, both nurses on our Cardiac Rehab unit at NMC. We'll be talking about what the program offers to our heart patients right here in our community. So welcome both of you, Nancy and Katy. Thanks for being here. It's going to be
Thanks for having us.
Yeah, it's going to be wonderful to talk to nurses about cardiac rehab. So first, tell me a little bit about yourselves. You know, what makes you a cardiac rehab nurse? What's your backgrounds?
You want to go first, Katy?
I've been a nurse since 1999, and I have critical care background. So I originally started at UVM Medical Center, and then transferred to Northwestern and worked in surgical services, and then just felt like I wanted to do something different. And I came to cardiac rehab a year ago, so it's
excellent.
Yeah,
great,
it's
great.
great.
And Nancy, you've been there in rehab a little bit longer, right?
Yes, I have. Well, actually, I got my start. I've been a nurse since 1973, which kind of dates me. But I started down at the then Medical Center Hospital of Vermont. I worked there for a year, and then I came to this very building, and I worked in the old St. Albans Hospital for about a year, and then I worked on the curbs unit in the medical surgical floor. After that, I worked in the emergency department for 23 years.
Wow.
As a part-time nurse. And then there was an opening for the cardiac rehab in 2002. And I've been there for 12, 13 years now.
Wonderful, wonderful.
So
you've got some stories between the two hospitals, right?
Yes. I mean, walking these halls this morning, I've been in this hall, you know, so it was like, wow. So, yeah.
That's great.
Very nice.
Wonderful.
Yep.
So what is cardiac rehab?
Well, it's an exercise and education program that we offer right here at NMC. We have two phases that we currently offer, one with telemetry and one without. The one with telemetry is an insurance-based program, and there's certain diagnoses that allow a patient to get into this program. There is an education component to that program, and the phase 3 program is on different days of the week, and that's a non-monitored program. It's kind of like a tweener program between phase 1 and phase 4. So NMC offers phase 2 and 3 as on an outpatient basis.
Okay. Now you have a little gadget in front of you.
Yes,
What
I
is
do.
that? When you said monitored, I felt your hand go up. So what is that?
Well, this is a little telemetry box, and this is the transmitter between the patient's electrical rhythm of their heart and a monitor screen that we are viewing while they are exercising. There's an antenna that picks up the signal from this little box to the monitor screen. And so every patient who comes in who's in the phase 2 program gets 4 of these little sticky electrodes attached to their chest, and they actually have it on them during the whole time they're in the program for that day, for that class.
And what does that tell you when you're watching that monitor?
We see what their heart rhythm is like. We see their rate. If they are developing a rhythm that could put them into any kind of jeopardy, we're watching that. It gives the patient some confidence that they're going to be able to go out and exercise on their own without any consequences, because they've just suffered a heart event, so they really want to know if they're okay to proceed with harder levels of intensity of exercise.
Right.
Yeah.
So how do people get into the program? What makes them eligible for it?
Well, they have to, as Nancy had said, suffer some sort of cardiac event, whether it's open heart surgery, if they've had coronary stenting. Our newest diagnosis is congestive heart failure. And we get a referral normally from UVM Medical Center. That's usually where the process starts. And then we reach out, we contact the patients to see if it's something they're interested in. And if they are, then we contact their cardiologist to get an order and get the ball rolling for them to get them in the program as soon as possible.
That's right.
So if a patient comes to our hospital and is having a cardiac event in our emergency department, then they might get transferred, right? Or they might stay, I guess, depending on what type of heart attack, but they might actually go to UVM Medical Center.
Yes, that's right, Jill. They generally start at NMC. Most generally, they do start at NMC, and we have a great collaborative effort or a program where actually they leave here and they go to UVM Medical Center for an intervention of sorts. It could be a stent placement. It could be determined that they need to have a bypass surgery, so they have some kind of inpatient procedure done, and then they come back this way. Yeah. So that's where the collaboration is. They send us these referrals, and then we act on it right away. We call the patient, are you interested, like Katy said, and then we send the orders on if they are. It's a voluntary program. It's not a mandatory program. It's voluntary. So we see great results when people start moving more, and it gives them confidence. It just builds confidence.
Sure, I'm sure people are pretty frightened after they've had a cardiac event, and having your guidance and builds that confidence, like you said, so they can get back to their activities of daily living.
Yeah.
And you see it when they come in the first day, the anxiety, and then even the second day, just a little brighter and calmer. It's really, it's a good feeling.
It is.
It's wonderful that they can come home, to their hometown hospital, in their own community, and to really get wrapped around with your care.
Definitely. All ends of Franklin County, Grand Isle County, and even northern Chittenden County are coming our way. So that's really nice. Yeah.
And they love hearing that it's available and they don't have to travel to Burlington again. So that's always a huge thing for them. They're happy that it's right here in the community. So
Yeah, easier to get to.
yeah.
So what does an exercise routine look like, and what do you do and what does a patient do?
Well, we can start from when they come in the door. We have them get their weight. We give them their chart, and which has their ID band on it, and they actually write on their own record, which is really nice. And we place the telemetry on them right away. We get a resting strip. We get strips at every level of exercise that they're doing. It involves not only aerobic equipment exercise, but they are doing stretching, and they're doing some resistance training with some weights, some low-level weights. So this all happens within an hour, and we get blood pressures along the way to see how their exercise pressures are doing. If the patient has a problem, we deal with that at the moment, they just go from start to finish, and before you know it, they're done, and the next class is coming in. I mean, there's a lot of good things that are happening in the gym during that time. We are watching the monitor while they're exercising. We need to, if they go out of their safe aerobic heart rate range, we don't, we have to say, no, you need to slow down a little bit. We need to give them the cue, and they, to keep them in their safe aerobic heart rate range.
And the program is very individualized too.
Yes.
Different ages. We have patients in their 30s up to their 80s, and some people with physical disabilities. So we really tailor the exercise prescription, so to speak, for their ability. Because we have people coming in thinking, oh, do I have to run like that person on the treadmill?
Everybody's in the program at a different
it's
level. Some might be on their 34th session, and here you got the newbie coming in, and they're looking. But that person wasn't doing that on day one either. So
it's definitely individualized, which I think is important.
Definitely, yeah.
So where are you located, and what type of equipment would one expect to be working on?
We're located in the Cobblestone building behind Northwestern Medical Center.
Okay.
We're upstairs, and we have rowers, treadmills, upper body ergometers, free weights.
Yep, bicycles,
Yes.
and then a combination of arm and leg modalities that are like new steps and physio cycles. And so if patients want to work their arms and legs, and not just their legs or arms, they can really go to town. That gets their heart rate going. And they get on there and they go. So there's some challenging, every piece of equipment can be made to be more challenging. Not just with speed, but with grade, like for example on the treadmill, can be made to be more challenging. So they don't start like that. We work them into it, so it's gradual, and then when they come back, they need to tell us what their perceived exertion is on that piece of equipment. So we want them to be in the fitness zone of being perceived exertion. And so they usually start out with, a low level, and then they just go. But then it's really very gratifying to see, right, Katy, at the end when they come back and they say, this used to be very hard for me, now it's not as hard. Their body's getting conditioned to physical activity. Yeah, it's something. something to see. It's slow,
Yeah.
but it's gratifying. Yeah.
So gratifying. I can see you both kind of beaming about your job. So, do you have some stories that really, stick out to you of the differences that you're making in people's lives?
Well, like Katy said, that first day when they come through the door, it's like, oh boy, you can see the anxiety, not knowing what to expect, and then they get going. And then there's some patients who really take hold. They start to become like, well, we had one the other day who got done the program, and he was pretty sad to leave. I'm not going to name any names, but he was tearful almost, and that's because he didn't really want to leave the program, but he had gone 36 sessions, and he handed this little card to us, and I'd like to read it if I may.
Absolutely,
and,
of course.
If you don't mind.
I'd love to.
So he said, Nancy and Katy, even though this is my last time at Cardiac Rehab, I wanted you both to know how special you are to me. From my first day to today, I never once felt anything but encouragement, support, and professional care from both of you. In my opinion, this is the measure of a great nurse. May each of you continue to help and support your patients, but more importantly, enjoy life. And between the lines, there's a lot to be said, and I think it's not to build us up, but I don't think patients really, when they leave, pat themselves on the back enough, because they did the hard work. Yeah. We were there to guide them, but they did the hard work, and they're grateful for that, because it gives them confidence to continue that level of exercise outside of the gym. Yeah. Without the guidance, they have the confidence to go on. So their outcomes have been met. That's gratifying.
Sure.
And so it is a success story when you hear stuff like this, that they got what they needed from the program, and now they can move on with their lives after this heart event. Very gratifying.
Wow.
So, yeah, so it's, this is, we take this to heart, literally, we do.
Yeah.
So
You're changing people's lives.
Well, they're grateful, and that makes your job really worth it. That makes you want to come to work and be here for them. Yeah.
You get to know them like family.
Yeah.
It's not just on that
Yeah,
level.
and there's a lot of networking. Like this particular patient, he was like the patriarch of the gym. The newbies that would come in, he'd say, "You better watch out because they'll tell you when to slow down," or they'll, he's kind of giving them and it's kind of funny to hear this little support. Got a support group within the support group. It's kind of funny.
Yeah. Oh, that's great. That's great.
Yeah.
Now, are you guided by a medical director in your program?
Yes, we are. We have Dr. John Fitzgerald. He's a UVM Medical Center physician, cardiologist,
Yes.
who's based here at Northwestern Medical Center for 4 days a week, and he's here on the days that we have our classes in Phase 2. So he directs that program.
Excellent, excellent. So, what's the future of this program? I mean, are there things to come?
Yeah, well,
to
there's
develop?
a lot. Well, we talked about that congestive heart failure diagnosis, and right now the push is to really target our primary care doctors in the area to give them information about that diagnosis, to maybe refer some of those patients to us to expand the program. And also, Katy, we were talking about the Rise Vermont.
Working with them to follow up. We'd like to follow up with patients after they leave.
Maybe with the Phase 4, like a patient like this who just left, maybe connect with them, because we currently aren't making phone calls to these patients who leave the program. So we would like to maybe, we're going to be looking into that soon, talking to them to see if they can help us with these people who've just left the program, and maybe have them continue with their
program. I think that's a great idea, because if they're trying to go back to work or something, and Rise Vermont is in the business, that the health coach can follow them right to the work site, or in the municipality, or in the community.
Yeah,
very
so
important.
I really like that, because when you think about it, we're trying to build a care continuum. So no matter where the patient is, it's not just when they're in the moment in your treatment or plan. It's how they continue outside of that, and those healthy reminders.
Exactly.
That's it.
And coaching. So
I like that
that's
idea.
wonderful.
Yeah.
Well, we're really running out of time, but what I'd like from each of you is that you're giving so much, and I can feel your emotion and your support. So what do you do to stay healthy? What do you do so that you're ready for these patients to give them all you have?
I actually attend Collins Pearly, the gym, regularly. I just
You
started,
do?
actually, since I started the Cardiac Rehab program.
Yeah.
Regular exercise, it's interesting. You want to practice what you preach, so I
Nice.
definitely go because I can't, instruct people on behaviors if I'm not doing them myself. So I go there regularly, so I
Excellent.
enjoy that.
Good,
Yeah.
good. What about you,
And
Nancy?
being a dairy farmer, my days are full. And plus I have garden and I keep active in the summer with that. But I do have an elliptical and I walk a lot.
Good.
So I haven't used my elliptical lately, but summertime it's busy. So I'm constantly doing things on the farm.
Good.
And it's bursts of activity, but I keep busy.
Excellent.
Yeah.
Well, thank you. The time has flown, but thank you
Yes.
so much about talking about how we care for our cardiac patients and for being available to them for that rehabilitation to get them back to their lives. So
Thank you for
Thanks for
having
having
us.
me. Yeah, thank you very
it's
much.
been wonderful.
Great.
My name is Jill Bowen, your host of the NMC Health Beat Show. Thank you for joining us, and take care of yourself. Do something healthy every day. Take care of that heart.